Fetal development is an amazing journey starting with two microscopic cells. These cells become a fully formed human over 9 months. Understanding this journey highlights the importance of prenatal care. Conception occurs when a sperm fertilizes an egg, creating a unique genetic code. This single cell, or zygote, rapidly divides and travels to the uterus. Once in the uterus, it becomes a blastocyst and implants into the uterine wall. This implantation establishes the pregnancy. The placenta develops, providing oxygen and nutrients to the embryo. The amniotic sac forms, cushioning the developing life. Around 3 weeks after conception, the heart begins to form and beat. Major organ systems start developing, including the brain and spinal cord. Small buds appear which will grow into arms and legs. By the end of the first trimester, the embryo is termed a fetus and has a recognizably human form. The second trimester spans from week 13 to week 27. The fetus grows rapidly and many body systems become functional. This trimester is often more comfortable for the mother with a lower risk of miscarriage. The fetus becomes more active with movements like kicking and turning. These movements, called quickening, are reassuring signs of well-being, and the senses develop significantly. The eyes can perceive light and the ears can hear. The fetus can hear the mother's heartbeat and voice, reacting to loud noises. Fine hair called lanugo covers the body, and a protective coating called vernix forms on the skin. The organs, like the lungs and liver, continue to mature. Fingerprints and footprints become unique, and the fetus starts to look more like a newborn. The third trimester begins around week 28 and continues until birth. The fetus gains most of its birth weight, with fat layers forming under the skin. Brain development accelerates with billions of neurons forming connections. The fetus experiences sleep and wakefulness cycles important for brain maturation. The senses become more acute and the fetus can open and close its eyes. The lungs continue to develop surfactant, preparing for breathing air. The fetus practices breathing movements, inhaling and exhaling amniotic fluid. The kidneys and liver mature, gearing up for independent function. As birth approaches, the fetus usually settles into a head-down position. The mother's body prepares for labor and the fetus receives antibodies for immunity. The final weeks are a time of waiting and anticipation. The culmination of this 9-month journey is birth. Labor begins and the mother's body works to deliver the baby. The baby takes its first breath and the umbilical cord is cut. Reflecting on the process, it all started from 2 single cells. These cells formed complex tissues, organs, and systems, creating a unique human being. Each stage, from the first heartbeat to birth, is a marvel of nature. Understanding fetal development highlights the critical needs of a developing fetus. This knowledge informs prenatal care practices and emphasizes maternal health. Educating expectant parents empowers them to make informed choices. The journey of fetal development is a profound story of growth and transformation. Each pregnancy is unique and the science behind it is fascinating. Appreciating this process deepens our respect for life and its delicate beginnings.